Hello everyone, I'm Fei-Yang, and today I'll be presenting an analysis of COVID-19 data using various visualization techniques. Our objective is to understand the pandemic's global impact using data from the WHO and other sources. First, please let me introduce the COVID-19 to you. Since the discovery of the COVID-19 virus, it has spread widely across the globe, causing significant loss of life and economic damage in the countries worldwide. And this picture is the number of COVID-19 cases reported to WHO, and you can see from this picture that there is many cases, and according to the data from the WHO, there have been more than 717 million reported COVID-19 cases to date. And let's start from a line chart comparing Singapore and Malaysia quarterly new cases. And you can see from the chart that the trends of the new COVID-19 cases in Singapore and Malaysia are generally similar. They also have a peak and the curve went down and then uh, rebound. But there is also some differences between these two countries, and you can see in 2021, the COVID-19 outbreak in Malaysia occurred earlier than the Singapore, and you can see that the COVID-19 first found during the 2022 January and peaks at 2022 April. Possi but in Malaysia, this time was earlier, approximate a year, yeah. It is possibly due to Malaysia's closer geographic proximity to China. And you can see then the curve went down, meaning that the COVID-19 has been controlled. But in 2023 and 2024, most countries eased restrictions on COVID-19, leading to a certain degree of resurgence. The rebound in Singapore was much more pronounced, and as you can see, it is possibly due to the Singapore's higher population mobility and larger influx of tourists. Then we went to a pie chart showing the proportion of several major Southeast Asia countries, the new cases. Yeah, let me start. And you can see now the South Korea part almost fill all the pie chart, filling the pie chart, and then now it's Singapore capturing 80% of the pie chart. In this pie chart, you can see COVID-19 new cases trend between these several countries, and it can be observed that almost every country experienced a resurgence of COVID-19, but the timing of rebound varied across different countries. Then we went to a heat map. First, we went to this map shows a global distribution of total confirmed COVID-19 cases. If you can see this case well, let's turn to this map, and you can see the United States, China, followed by India, Brazil, has the most affected per people numbers in the world. If you hand on your mouse to the land, and you can see the exact number of total cases in there, and Russia. Yeah, we can see from the chart that the countries with the highest total number of infections, China and United States, as I mentioned above. And more interestingly, Europe is also a heavily affected region by COVID-19, as we can see. Then we went to another heat map showing the death rate of COVID-19 by country. And also you can see this big map. As you can see, the China's death rate is 5.5, around 5.5, and Australia death rate is around 5.7. And you can see from this figure that the death rate in Africa is relatively high, which may be related to the lower level of healthcare in the region, as many patients are unable to receive timely treatment. More interestingly, the high death rates in Europe, as we can see, there are many dark red countries in Europe. It might be attributed to factors such as an old population and the strain on healthcare systems during the peak of the pandemic. And then we went to a scatter plot. First of all, let me introduce this index, calling UHC Service Coverage Index. It is collected from the WHO official website, and you can simply understand it as it measures how well a country's population have access to essential healthcare services. And you can see in the chart, and I also made a regression curve. We can see we can see that the UHC Service Coverage Index is positively correlated with the vaccination rate, meaning that countries with better healthcare coverage tend to have higher vaccination rates. There are still some outliers in the regression progress, as we can see the South Africa with a high UHC coverage index but low vaccination rate, and Yemen, extremely low vaccination rates, and other points are around the curve. Yeah, you can see there are still some outliers in the regression progress, and we need to conduct a specific analysis of these countries. And then I'd like to conclude my study. This study utilized various data visualizations to analyze and better understand the global impact of COVID-19. Through the comparison of infection trends in Singapore and Malaysia, we observed the unique ways these countries experience and manage a pandemic. The pie chart animation highlighted how the proportion of new cases shifted across Asian countries over time, and the global heat map provided insights into the uneven distribution of total infections worldwide. Lastly, the scatter plot with linear regression demonstrated a positive correlation between vaccination rates and the UHC service coverage index, though outliers like South Africa suggested further factors at play. Overall, this visualization offers a comprehensive perspective on how healthcare infrastructure, policy responses, and public trust play crucial roles in shaping the pandemic's outcomes. And that's all. Thank you for watching.